One takeaway is that we're ensuring that we're using AI in a responsible way. So making sure that we have the right governance to do this in a way that's safe, that's transparent, and that we can ensure we explain to both end users of the AI and our patients why we're doing it. We're making sure that we're being experience-led. So by that, what I mean is we're out there listening. We're listening to our patients. We're holding focus groups. One example of being experience-led is our Check Symptoms and Get Care AI-powered symptom checker. And that was to address a pain point that we heard that when patients start having symptoms, they're not always sure where to go. And AI is one way that we can start to take those symptoms that they're having, match it with evidence-based protocols, and help patients be in the driver's seat for where is the next best place for them to go. We know that AI tools are starting to make their way into the workforce, and that as we move into the future, we'll see more and more co-pilots as the newest member of the team and someone that can help you at work get through those key tasks of the day and focus our time on our patients who really are going to benefit from that the most.